Okay, I'm Bill Gardner. I'm 72. 14 years ago, I was diagnosed as having dry macular disease in one of my eyes. There are two kinds of macular disease. One is dry and one is wet. Dry macular means that the point at the back of your eye where all the light is focused that you take in is a tiny pinprick of light. And the point that hits the back of your eye wears out, many specialists say, wears out rather like a carpet does. And so all of the receptors that normally turn that into normal vision become dulled. And macular degeneration, as I understood it then, meant that it was a very slowly progressing disease. It affects people mostly in the age of over 55. It then progresses very slowly, and you can be lucky, if there's such a thing, you can be lucky and get all the way to death without having your vision seriously affected. You can be unlucky and have it affected in a few years and then get progressively worse. That's what I had in 14 years ago. And there was no effect, particularly on my life, because my vision was very good. I was just in the early stages. And then 2 years ago, in a routine examination, I was told that my right eye had gone wet. And that's for many patients what the dry form progresses to be wet, and that's in many ways much worse. Firstly, it progresses much faster. It produces a macular spot, it's called, in the center of your vision, which means you can't recognize things you're looking straight at, but your peripheral vision can remain relatively unaffected. But the wet macula is caused by blood leaking into the back of the eye from the blood vessels in the eye. And what I didn't know then, and we only found out from a lecture at the Macular Society a few months ago, blood inside a blood vessel or an artery is in its perfectly normal place and is good for the body. Once a blood vessel bursts and that blood is allowed to leak into places where it doesn't live, it becomes caustic, and it produces scar tissue in the back of the eye. Therefore, if you have wet macula and the back of the eye bleeds, which they all do, the effect on that is that you have very seriously blurred vision in a central spot. The people concerned don't want to let on that they can't see very well. So they will do anything, generally, they'll do anything to appear normal. So it's very difficult for the public to spot it. But the signs are there sometimes. But blind people and sight-compromised people can be very defensive. But I think if any member of the public is aware that if they offer help, like can I read these things on the supermarket, that the blind person or the sight-compromised person, if they react a bit defensively or aggressively to say, no, I'm fine, not to take that as an insult, but just to accept that those people are hurting, and that's why they're responding like that. And that's no reason why they shouldn't try it again next time they see somebody who might need a little bit of help. The statistics are approximately 1 in 5 people over 60 will have macular degeneration. That goes down to 1 in 3 people over 80. So in the population of Guernsey, you'll have perhaps 1,000 people who are suffering from the condition. And as we get an aging population, that is going to increase, not decrease. One of the things you have to remember about macular disease is that appearances can be deceptive. So you can see a person walking through the supermarket and you would never know that they can't see very well because they've got peripheral vision, so they can see to walk down the aisleways and they can see at a distance some of the product ranges they want, well, be it cereals or baked beans, but up close they struggle. And they have to get up close to read the stuff on the packet that they want to read. And there's the dilemma. So you can appear to be quite normal, but not be quite normal. And the giveaway, of course, is when you see in a supermarket, you see somebody with their nose 2 inches from a tin of baked beans, desperately trying to find an area of their eye which can read the small print that they're looking for. And when you see, and there are lots of examples like that. If they want to read the newspaper, for example, they can either say, well, I can't read the newspaper anymore, or they can say, I can't read the newspaper in the way I used to read the newspaper, so I need a device, a something, be it electronic or mechanical, a magnifying glass, a computer screen, something that blows that print up and allows me to read it. And there are a million examples like that from every day. Needlework for women, hobby work for men, books, watching television. How do you watch television if you've got to sit a long way away from it in order to get it in your peripheral vision, but that's too far away to see the detail? Everyday things that are really difficult are restaurants. You'll probably have noticed in the last 20 years, or I've noticed, in the last 20 years, the writing on the menus gets smaller and the light gets less. So they dim the light, and you're trying to read a menu in dim light. Now, the one thing that a macular person needs absolutely is the best light possible to have even a chance. And you'll see in restaurants these days, you'll see people with their iPhone set onto the spotlight, and they read the menu by running their iPhone over the menu card. And it'd be nice if places began to become aware that not just macular people, but a lot of elderly people have slightly compromised eyesight, and dimming the lights and printing the menu with blue on white, pale blue on white paper is only going to be visible to people with beautiful, wonderful eyesight. So those are some of the everyday things that can be frustrating, but are relatively easy to put right. I think it's very difficult for anybody to understand the impact that any disease has on somebody that has it. If you don't have diabetes, how would you know how a diabetic is affected by everyday life? If you don't have cancer, how do you know how a cancer patient feels who is in remission, but doesn't know when or if the disease will come back? I think people simply can't identify what it is that affects somebody that has an eye condition, particularly if it's a progressive eye condition like we have. The way you can achieve that is by more publicity concerning the conditions, such as you're doing now, just to bring it more to the attention of Joe Public, so they can begin to recognise that the person with their nose an inch from the baked beans tin might have the need of some help. And wouldn't it be nice if you saw that in the supermarket and somebody went across and said, if you're struggling, can I give you a hand for 5 minutes? We'll walk around and do some of the shopping. We created a group called Guernsey Macula Society for all of those people who've got the condition to come and mix with other people who've got the same condition and learn how to deal with it. So I've listened to lots of them talking about things they have to deal with, things they struggle with, things that affect their psyche and get them depressed, things that frighten them. And we've, in that group, which meets once a month, we've tried to find ways of having visiting speakers come in to talk about motivational stuff, attitudes, blind people coming in to talk about ways in which they cope. And the evidence is there, after running this for 2 years, the evidence is there that if you keep a positive note going through everything, some of those people, or all of them, can start to feel better and can start to feel more ambitious about what they might or might not try to achieve.